Are you able to see that?
I can, yes.
Perfect. All right. Go this way. Are you gonna? I don't want to leave it. I just can't do it. Die now. Oh yeah. They do that. You know.
All right, can you ladies still hear me?
Yep. Yep.
Oh, perfect. Okay. Well, I just got a message from Carly to go ahead and start. So I think
Perfect.
she started the recording. So welcome everybody to our first ever Webinar Wednesday. I'm very excited to start this series of webinars that is geared towards brain injury survivors, their caregivers, and healthcare providers as well who care for individuals with brain injuries. My name is Janet Petchuk. I work with the American Heart Association. I am the director of what's called the North Dakota Mission Lifeline Stroke Project. It is a 3-year initiative here in North Dakota to improve systems of care with the goal of improving every link in the chain of survival for an individual who experiences a stroke, with the hopes of them having a meaningful recovery. And as part of that, we have gotten to start working now with North Dakota Brain Injury Network. Just this last year, in 2019, there was legislation passed that allowed for stroke patients to be included in the definition of brain injury here in North Dakota. And this is great because that opens up the North Dakota Brain Injury Network as a great resource for individuals who have had strokes here in our state. And of course, the Brain Injury Network also works with individuals of any type of brain injury. And in visiting with the North Dakota Brain Injury Network, we came up with the idea of having these webinars with varying topics that would be of interest to any individual who has had a brain injury, like I mentioned, as well as their caregivers or healthcare providers as well. Carly Endress is not able to join us at the moment, but she will be leading many of these webinars in the future. Our goal is to have these weekly to begin with, and we certainly would love to hear if there's any topic ideas that you have for us. You have Carly's contact information is listed here, her email address, as well as a phone number. And today we are very excited to introduce you to Neely Hoffman. She is a speech-language pathologist, as well as Melissa Anderson, an occupational therapist. They are here with us today from Quality Living Incorporated, located in Omaha, Nebraska. QLI is a medical rehabilitation center which specializes in traumatic brain injury, spinal cord injury, stroke, and other neurologic injury. I'm now going to hand over control to the QLI team, and they'll be telling us about what they offer for TeleRehab services. This is certainly of great interest in a state like ours where we have such rural areas in the state where there's a long distance to travel to receive rehab services. So I will hand things over to you, Neely and Melissa.
Thank you. Thank you. We are just going to start our PowerPoint here. Okay.
All right, thank you guys. This is Melissa. As Janet said, I'm the occupational therapist. We're really excited to be your guys' first one. I guess I didn't even realize that. So excited to be here today to talk about not only a little bit about QLI, but our new program, which is a TeleRehabilitation program. So I'm going to get us started, and then Neely will jump in from there. I'm hoping everybody can see the PowerPoint. If not, please let us know.
We can see it.
Okay, perfect. All right, so just starting off, we like to start off with just a bit of quotes, just technology. So Technology is new and upcoming. Things are changing pretty rapidly. And so as technology changes, the healthcare system is also changing. And so that means the way that we're delivering services can be expanded as well. So it really has created that fundamental shift in how we're thinking and acting. And as technology continues to grow, as therapists, we have to learn not only how to use that technology, but to also help our clients and caregivers know how to use that as well and incorporate that into rehab services. We're office fans here at QLI, so just humor us with some of these pictures. So TeleRehab, the future is here. So really the goal of our presentation and webinar today is just to give you some background on how we're delivering services and how we're using TeleRehab to redefine what we're already doing at our inpatient setting and how we can reach other people in states like North Dakota. So really what we're here to do is to provide access to expertise in specialty care. So before I kind of go into the nuts and bolts of things, just to give you a little background on QLI and who we are an inpatient facility located in Omaha, Nebraska, who delivers services for young individuals that has sustained a brain injury, spinal cord injury, or stroke. So really those neurological injuries. So our inpatient program serves those individuals on campus, and a lot of times we're discharging people back to their homes. So we get people from across the United States that come to our inpatient services, and our goal is to always get them back home into their community and home environment. So that's kind of where our TeleRehab program fits in, is once they go home, we found that when they're discharging to whatever state they're going to, there's a lack of services when it comes to just knowledge of expertise in specialty care with the brain injury population, stroke, and spinal cord. So a little bit of background on who we are in an inpatient and how this kind of developed as we've seen people go home. I think TeleRehab also just provides that continuity of care. So just thinking about, again, if somebody is in an inpatient program and needing to go home, then they really need somebody to know their injury. And so thinking about the brain injury population, it's a really narrow just knowledge. And so as therapists, we really know brain injury. And so that's continuing that care once they get home is especially important, just knowing and understanding learning. And Neely will go on a little bit more about learning and how important that is, not only after a brain injury, but also for caregivers and how important that is once they are home in their community setting. The other good thing about just TeleRehab and what we found with delivering services is just that contextual training environment. So really what that means is just looking at the home environment. So if someone were to go to a typical outpatient clinic, they're going to be kind of confined to that area. So thinking about that outpatient clinic's kitchen or that outpatient clinic's grocery store. And really with TeleRehab, we're wanting to provide that just training environment where it's their grocery store, it's their kitchen that they're practicing. It's getting up from their chair that they get up from every single day. So that's really valuable. What we're finding with the clients that we're serving is just how important their environment is. Convenience, I think this is an easy one to sell. Thinking about states, I know Nebraska has quite a few rural areas. That convenience factor is so large of not having to drive, 60 plus miles to a clinic that might not even know a lot about the injury itself. So I think this is a big one when we talk about states as North Dakota and as Nebraska that have a lot of rural opportunities. So they're not even having to leave their home environment to get really good expertise level of care, that they have therapists that know their injury and are able to do it right within their home. Obviously, this is kind of a straightforward thing, but it does reduce travel costs and time, as well as just improves compliance. I think that compliance piece is another big one. Thinking about traditional outpatient clinics, a lot of times people can miss appointments or maybe not comply with their home exercise program, and delivering TeleRehab the way that we have been, it's right in their home, and so they're more apt to do it because it's just super convenient. And that kind of goes along with the compliance is the accountability and responsibility. So I think there's an accountability on not only the patient side, but also the caregiver side of, even if we're seeing them only a couple times a week, that transition and follow through on those other days in their home environment is going to be really important. And so having that accountability and responsibility, not only for the patient, but also that caregiver. So there are some barriers with TeleRehab. Just wanted to just jump right in and talk about that. So some of the barriers just to thinking about these, I think one of the first questions I always get is, you're an occupational therapist, how do you deliver OT via tele? And I would tell you it can be done. Same thing with PT. That's another question that I get quite a bit. I think speech therapy is a little bit easier to understand, and obviously psychology is also easier to understand, but just thinking outside of the box of what traditional therapy looks like and how it can be delivered. Unsure of capabilities, just thinking about, that person's capabilities and not knowing, not meeting them, is that going to be a barrier? Sometimes that can be a barrier to what people are adopting. Quality of care and objective measurements. So really as a therapist, when we are evaluating and treating individuals with brain injury and spinal cord injury, a lot of times that objective information is super important in in-person evaluations. But those can also be done by a therapist via tele, but again, a barrier to note. Outcome measures, because this is so new and such a new way of delivering healthcare and delivering rehab, there's not a ton of research or outcomes out there at this point that support it. However, I do not doubt that in the next couple of years that this is going to be something that you guys will continue to hear about. I'm sure you guys have already been hearing a lot about just within the medical field. I do not doubt that you're going to be hearing about it more and more within the rehab world as well. Another barrier to adoption, I'm sure that you guys are all aware of technology, and it can fail. And, that's obviously something that we experience, but have also been able to work around. Technology is technology. Sometimes it's hard to predict, but that's, again, another barrier. Wi-Fi and cellular connectivity. So, in order for this to be successful, knowing that connectivity is going to be important as far as being able to carry out the programs and obviously see the client as well. So that's just another barrier that we identify, but also can work through. And last but not least, just the public policy, regulation, and funding. So I'm sure there's going to be some questions just about funding at this time and kind of what we do accept, and just public policy with that. Again, because telemedicine and telehealth is so new, there's such new regulations, and those regulations and policy changes are changing very quickly. So that's going to continue to be something that we work through. But again, we're still seeing some people and have had some great outcomes.
Yeah, so I know that Melissa mentioned a little bit about learning. And so before we kind of dive deeper into what TeleRehab, the process looks like in the application, I wanted to talk a little bit about the concept of learning. So even with our inpatient folks and transitioning into the rehab world, how is it that we're continuing to help these people with these neurological injuries learn? And I think the biggest question that we have to ask ourselves as clinicians is, how is this person going to learn best? So me as a speech therapist, when I have an assessment with someone, I'm really looking at what does their memory look like and how is that impacting their learning? So whether that's they're learning implicitly, whether they learn explicitly through consequences, what is it that we're doing to help them learn best and continue to build those neurological pathways? So one of the concepts that we talk about is specificity. So like Mel had mentioned, when someone is going to their home, how is it that we're able to do things in their home environments, in real life situations, that they can carry those things over best? So for example, when I'm doing rehab with someone at QLI or on TeleRehab, if they are going to be cooking, for example, how is it that they're going to be cooking? Are they going to be walking me through the steps, or is it more beneficial for them to actually be cooking in their own kitchen with real ingredients? Looking at those situations, what is it that they're going to carry over the best? Looking at the complexity. So let's go with the cooking example. Are they going to be making trail mix, in a four-walled room with, a few ingredients, or are they going to be making something that they can make for their family? Say they want to do something more complex with several different items, something that they were probably doing before injury. So what complexity are we tying to that situation? Also, one of the most important pieces is just repetition. So whether that person is just doing it with me for a session, how is it that we're training family and caregivers to continue to do that so that they get the right amount of repetition with those tasks, so that they become successful with those? And last but not least is just the coaching and support. So whether that's me supporting them through a session, whether that's me coaching a caregiver through how to carry over those skills, or a family member on how to carry over those skills, or what kind of support are we providing from modeling, from visual support, how is it that that person is going to carry over those skills best. All of those things are just things that we look at before even starting this person's really their program and at home what they're going to be doing. So next, I just want to talk a little bit about, after giving some background, just the process on how this TeleRehab works. So like we said, the people that we are serving now are brain injury, spinal cord injury, other neurological injuries such as stroke. We do have a new program that is specialized to amputation. That is something that we actually just started, and something that we're also starting to look at a little bit more is just how we can tie in physicians to our program as well. Right now, we are what you would compare to an outpatient therapy like program. So we don't have a physician on board, but something that we feel like could be pretty beneficial just in the future. So something that we're also looking at. Like I said, we have occupational therapy, physical therapy, speech, psychology. So a lot of times we will be getting people from our inpatient rehab. So we like to do in-person assessments with them if they are here on our campus. If they're not on our campus, we have gotten some referrals that are not within the state. And so we will go out there, we will do those assessments likely with them. And then whatever makes the most sense, whether that's physical therapy or speech therapy, virtually doing their assessments while one of our other team members is out there, we can also do that. Just to meet that person face to face and really get some good, just a good evaluation of kind of what that looks like, what their home environment looks like, and then carry on those services once we get back. So just about kind of like the access expertise, who might be appropriate for who we're serving. Like Mel had mentioned, you know, Nebraska, North Dakota, it's very rural towns. People might not have a lot of access to care. But I could go back and say that also people coming from a metropolitan area could benefit from this as well. I will give an example. Someone that we worked with from the Chicago area who had, you know, quite a bit of opportunities for an outpatient level of care. They just weren't getting someone that was as specialized in brain injury to provide that level of care that he needed. He was a couple years post-injury, and the family was just kind of looking at, gosh, he has been out of intense rehab for this amount of time, and we're just not really making any gains, and we really just need new ideas. So fortunately, we were able to step in and just say, these are some of the things that we feel like what would be necessary for this kid to work on, whether that's just his ADLs in the morning, how can we make those more efficient? How can he be more independent with those things? Spending time alone, you know, starting to do things more independently. He was in his 20s, so was living by himself before. So can you start making your own meals? Can you start volunteering / working again? All of those things we were able to do from a distance and evaluate him in those situations to really just level his level of care. And we did that at the community level, went out to his community and were able to evaluate him in those situations, which was really exciting.
Yeah, so I think one of the biggest take homes about who's appropriate for TeleRehab is thinking about those individuals that are at that community-based level of care. So in, like Neely was talking about, so they're living within the community, they're in a home setting, they would be appropriate for going to an outpatient therapy setting, then they would probably be appropriate for our services. Okay, so it's me again, connecting therapy to life. So I think one of the things that we pride ourselves as far as our inpatient program, but also our TeleRehab program, is how individualized each program is. So the story that Neely talked about, that client, they had very specific goals and very individualized goals of what not only that patient needed, but also what the caregivers and family needed as well. So we built that program based off of his and that family's needs. So really what our goal is to provide that really meaningful, individualized, and engaging therapy in the client's own environment. So I think that's a huge takeaway from hopefully this webinar, is knowing that with delivering those services, that really is our goal, making sure that it is as individualized to that person. You've heard us talk a little bit about caregivers. So Neely and I just wanted to put in there, put this quote in there, just discussing caregivers and how important. I'm sure there's some caregivers on the line right now or that will be listening to this webinar, and you guys are so important as part of this, as the recovery process with individuals with brain injury, especially if they're back at home with you. And so one of our main goals too when it comes to delivering TeleRehab is knowing that you guys are a big role in their lives in that community, and how can we be helpful training and carrying that out and collaborating with you again on what your guys' goals are together as a caregiver, as a client. So this is a research article that we wanted to put in, just this quote. Participants reported that caregiver meditated exercises made them feel more actively involved in the rehab process and prepared them for the home situation. So more and more research is coming out that including the caregiver on the rehab process and training the caregiver to deliver therapeutic applications while they're at home with their loved one or that patient is just as important, because as you know, delivering outpatient therapy services, it's not going to be every single day throughout the day. You're getting us a couple hours a week, if that. And so I think that that's a really big point that we wanted to be included in our program, is not only the importance of that person's program, but also the times outside the day-to-day. So let's go on a little bit about the process, so how we do this. So we use a video conferencing technology platform. So essentially the platform that you guys are all on the webinar today, Zoom, is what we use to deliver services via Tele. It's a HIPAA compliant platform. So we do it similar, I'm hoping you guys can see us, but it's a face-to-face interaction. So that's really important as we're delivering TeleRehab for all disciplines, PT, OT, psych, and speech. So again, that video platforming, we have the ability to do some video recording, which has been really helpful for some of our clients. So thinking about those individuals that have memory deficits, sometimes holding on to what we talk about in therapy is difficult for them. And so with some of the capabilities that Zoom has, we're able to record our sessions, and then they're able to upload, or the caregiver is able to upload and watch to see, oh gosh, how did Neely do that again in speech therapy? How did Melissa in OT do that again? How did she cue them? That video recording capability is so important for those individuals. It just has some really nice tools. So as you can see, we're sharing our platform on this, sharing our PowerPoint, on this platform. But for individuals that are using TeleRehab with their iPad or their phone or their laptop, we're also able to see what they're doing. So let's say Neely is working on schedule and structure today and looking at that individual's week. There's that capability to share on your iPad with the Zoom platform so that she can see exactly what the patient is seeing while using the iPad or the laptop. If using a laptop, the nice capability is that we are able to take over their screen. So that's kind of nice as a therapist. If they're having a little bit of difficulty navigating and someone's not with them, then we're able to kind of jump in and help them along that way. So really nice features that's offered through us and really therapeutic for those individuals. And then the last but not least is just chat features. So let's say there is a little bit of technology difficulties. I think even earlier starting this webinar, we had a couple issues signing on. We're able to use chat on there just to make sure we can help them problem solve, but also help us as well to know kind of what they've tried. So the hardware that we use, like I kind of mentioned already, we wanted to make it really accessible and really convenient. So we want it to be really remote. So again, I talked a little bit about not only using in the home environment, but also the community environment as well. And with using it in the community environment, we really love it to be mobile and remote. So we do have individuals that use their phone, their tablet. I have a patient right now that they use their laptop. It is recommended just to have a cellular data plan. I think that's just nice because it allows you that capabilities to go outside of being connected just to Wi-Fi. Not to say that's necessary, but if we're talking about goals for individuals, that community is one of them, then it is nice to have that cellular data plan so that you don't have to worry about just always connecting to Wi-Fi. We use device mounts and equipment. So if somebody is using a phone or an iPad, having a mount is kind of seems like such a small thing, but it's actually a big thing so they don't have to focus on holding that iPad or holding up that phone. So we found a couple of mounts that we feel like are really durable, but also really easy to work with and can kind of take on the go. So that's another thing that we use. Headphones, I think that's really important. You know, some individuals that we see in the gym or again in the community for their own, you know, dignity and for their own just privacy, we do recommend some headphones. And then we already talked about the remote site requirement.
So now we can just dive a little bit into what is it exactly that we do from a therapy standpoint. So I know a lot of you are probably still wondering, what does this look like from an OT, PT, or speech therapy side of things? So really from an occupational therapy standpoint, Mel works a lot on not just what you picture as, you know, your typical occupational therapy tasks, so like your ADLs, fine motor activities, but also really just getting that person back into life doing independent skills. So whether that is, like I mentioned, refining some routines in the morning, working on whether that's even just like bathroom things too, or whether that's getting dressed. What are some easier ways that we can do that? Also, cooking. I think a lot of us take for granted our ability to just make a bowl of cereal in the morning, or you know, make a very simple meal. That is something that she's working with that also ties in a lot of those fine motor tasks, but also focusing a little bit on those cognitive pieces as well of sequencing, you know, problem solving, reasoning, all of those things. Formally doing some vision therapy as well. That is something that's a little bit more concrete that that we do virtually as well. Like I mentioned, environmental accessibility and adaptation consultation. How is that person accessing, you know, the community, their home? What are things that are going to make that a little bit easier? Mel and our physical therapist, Brad, are collaborating a lot on what does that look like, especially if they're working, you know, maybe someone with a spinal cord injury. How is it that they're accessing their home best, and how are we helping progress that person? And like I mentioned, just that fine motor sensory integration training. Also some more concrete things that we're doing with people, whether that's like handwriting, or maybe there's a game on an iPad that we can share the screen with and they're able to do some of those things, and we can see how they're doing with those as well. From a speech therapy standpoint, I think that it's a little easier to visualize what that looks like. You know, just formal speech, that is something that obviously I'm working on with some people, whether that's voice, articulation. Those are things that I have worked with people on, but I will say that given just that all these people have neurological injuries, the main thing that I'm going to be focusing on is just that cognitive aspect. So whether that's their, you know, the executive functioning, so memory, problem solving, reasoning, organizing information, I think that's something that I'm always looking at. Like I mentioned before, memory plays such a big role in someone with a brain injury and how that person is going to recover, and what their therapy is going to look like. And so I'm doing a lot of different things, from just building someone's actually ability to be more independent. So I'll give an example of I work with a young guy who was in our inpatient facility and got a hold of him, you know, a couple years later, and he really was working on how do I go back to school? You know, I was in college when I had my injury, so how is it that I can regain the skills to live independently, go to school, have a part-time job, you know, so many of those things that he's not doing anymore. So a lot of the times that we spend together, we're working on planning for his assignments. Where is he going to store that information so that he's able to remember to do it? when is he getting homework times completed? What times is he working? We're going through his schedule, organizing that information. We're doing social skills. So, a lot of the times we'll see people with some of that social pragmatics that plays a big role in their lives, especially following a brain injury with some of those frontal lobe deficits. We will see that. So working a lot on that. And I think it's really cool that I have the ability to go with someone into an environment, maybe join them with their family when they're eating out, and just kind of be a fly on the wall, and then follow up with them about, what are some things that we could work on next time. And then another thing is just obviously that exploration of purposeful daily activities. So like I said, structure of their day, going through their iPad and kind of structuring out, okay, in the morning, this is what you're going to be doing, going to the gym, volunteering, putting that on their schedule so that from a memory standpoint, they're able to anticipate what they have going on and recall what they had maybe previous days as well.
Yeah, and just going back to your point, Neely, the individual or the young man you're talking about, I think one of the nice things about that situation, you're obviously helping with all these life skills, but it also is so helpful for his mom and family. So thinking again about that caregiver and that support, and mom's like, gosh, if you guys could take that, and it's hard for me to always be the one providing that oversight and, telling him socially about his skills and kind of nagging him a little bit about school and helping him. She's like, I am helping and I feel like it, but it's just kind of taken me out of the scenario a little bit and given it to Neely, who's obviously the expert when it comes to helping that young guy out. So I know that that's been invaluable to them as well.
Yeah, and I think for all of our families, whether it's, on campus here or as we're seeing them in an outpatient-like setting, I think it's obviously that fine balance of, how do we give that parent or that family their role back as a family member or parent rather than a caregiver? Because there's some of these situations where, they've gotten to that role of, they're having to care for their loved one 24/7. So how can we take them out of that situation, and how can we step in and provide some of that training and help them become more independent? I think that's a huge goal as well. So from the physical therapy side of things, I might transfer that over to Melissa. She might have a little bit more information.
Yeah, so these are some of the things. I think that these are pretty straightforward when it comes to delivering PT. But I think that this is going to challenge you a little bit to think about how to do this virtually. So our goal is to kind of go through a couple of these things, but we also have some videos that we'd love to show you guys. And we've gotten the okay from all the clients that we're going to show you that we could kind of share how it's delivered. So back to PT and how we kind of deliver that, kind of the same goals that you would imagine: gait, mobility, endurance, movement disorder, some musculoskeletal impairments, some ataxia. We've also worked with individuals just on some pain treatment, and then I think overall the health and wellness. So I think that's been a huge one that we've seen a lot of somebody, especially transitioning either from an inpatient program or they're at home and they're physically able, they just don't have a program set up. Our physical therapist is really skilled at coming in and looking at what their community gym looks like. Can they get back to some sort of gym program, setting up what that program looks like, and then progressing it, which is super valuable to these clients and their families, not knowing a lot just about how to progress somebody. So way different than you would expect if you or I went to a gym, a physical or a trainer would know kind of how to progress and reach our goals. Well, with somebody with a brain injury, they're not going to know kind of the areas that they struggle with, whether that's balance, gait, or endurance. And so our PT has just been really helpful in looking at kind of that bigger picture and to not only look at just their health and wellness within a community and gym setting, but also within the house. So the gentleman, I love this story, and I think that Neely was talking about him earlier, the gentleman that lived in Chicago who was living with his parents. He physically, I think our physical therapist came in and was like, oh gosh, he could be doing so much more, walking so much more, and have so many more opportunities throughout his day than just being in his wheelchair. So I think even taking a look at that and saying like, okay, we're just in this routine. How can we kind of get out of that routine, and how can a PT or an OT kind of help us rethink the situation and see how we can get him up and more active throughout his day. I think okay, so the next one is psychology. I think this is a really important one, and one that we see with a lot of our individuals, and see the importance of having psychology on board with the majority of the patients that we serve, especially after such a significant injury. And I'm sure all of you guys on the phone or on this listening to the webinar know that, you know, no one plans these life situations, and whether you're in transitioning from an inpatient program, whether you're years post, there's a lot that life happens after an injury, and especially after a brain injury, and a lot of things that are different and that look different. And so psychology has been a really important piece of our TeleRehab program. Again, not only for that patient, but also the caregivers, as well as just having that person who knows the injury, knows the person as well, and helping them with how this looks and processing all of that information after. So our neuropsychologist specializes in post-concussive treatment. She helps, again, a lot with just those family dynamics and social relationships. I think it's been really great. I think Neely would say this as well, is just as a team being able to collaborate with their psychologist. So even if Neely's seeing him from a speech perspective and me from an OT perspective, and then maybe they're seeing psychology, we're able to kind of tie all of those pieces together, because that emotional piece is just as important as the clinical OT, PT speech. So I think that that is just a really unique part of our program as well, and really emphasizing that emotional piece with our clinical psychologists. Adjustment after a life-changing event, I kind of already talked about. And then she also is very skilled in just the cognitive behavioral therapy as well. Emotional health and wellness, I think this kind of goes back to a little bit with like PT. So, you know, that could look like, from a psychology perspective, mindfulness or meditation. So just really looking at somebody's routines and how they've been adjusting and what their emotional day-to-day looks like, and how they can incorporate more health and wellness into that program from a mindfulness standpoint.
So we're going to go a little bit into the videos, just to give you guys a little bit of an idea of what does this actually look like. So Melissa mentioned that we are able to record on our screen some of the things that our patients are doing, not only to show them, maybe give them some helpful hints, but also just for ourselves to review. So
and we hope they work.
We're hoping that they go through. So talking a little bit about this one, this is a guy who was in our inpatient facility, transferred back home, living with his family. He came to us really not doing a whole lot. He was wheelchair bound, not talking at all. His memory was severely impacted, and he's just made a ton of progress. This is our physical therapist, Brad, kind of walking him through going up and down stairs. He's at his local gym in his neighborhood, in which that's where they hold a lot of their physical therapy sessions. Brad is walking him through how to do these, but it kind of started with caregiver support as well. So you'll see in this next one. Skip ahead just a little bit. So Brad is coaching through one of this gentleman's caregivers. He's kind of coaching her through, you know, how much support she's giving him, kind of coaching him through what the task is. Given that he does have some cognitive deficits, I think that's something that a lot of times we need to take into consideration. How much is this person able to recall? How much are they understanding the amount of information that we're giving them? Let's see if we can show you what. So here he is doing ropes at the gym. So Brad's also just coaching him through, what does that form look like? How many repetitions do you need to do? Brad's great about really challenging people as well. I know that this guy, he'll often say, like, I'm way too tired, I can't go anymore. And Brad's like, just one more second. So that one, I think that's, yep. and probably his first time being back at the gym since prior to his injury as well. Oh. So this one, I wonder if I can play some video. So I'm going to pause it just a second to explain what this one is. This is a speech therapy session. What I'm focusing on with him, he is reading one of his children's books. He has two really young girls. And the goal of this is not only to work on that expressive language. I want him to slow down. I want him to over-articulate. But I also want him to be able to tell me what he's reading, to recall some of that information, so that I explained to him, you know, if he was reading to his child and they asked him a question, could he explain that to them? His caregiver is right next to him in this, and I think this is really helpful, just given that he was bilingual prior to his injury, and right now he mostly speaks Spanish, but she's there just as a support to not only for him, but also to help me a little bit in understanding just with that language barrier.
We could hear him speaking at first, but now I'm not hearing the voice.
Okay. Well, he was kind of just walking through a little bit of, I was just showing you an example how he was reading the book, and just the support the caregiver was kind of providing in that situation. So we'll go to this next one. This last one on the slide is the young guy who is learning to cook again. Mel might be able to explain this a little bit better.
So basically, Will here is working on, you know, he lives with mom and dad. He's 28 years old, but really wasn't taking a role in any sort of meal prep. And so as we kind of dug a little deeper just into some of his goals, one of his goals was to be able to cook a meal for his family once a week. So he's like, my mom and dad do so much for me that I would love to be able to plan with you, Melissa, and cook a meal once a week for them. So as part of our therapy, one day we would spend planning a meal without his mom really kind of knowing. He would plan out the ingredients. They would go to the grocery store together, and here he is just working on some of those stovetop skills. Obviously, mom's there to be a support, but he really took pride in and ownership in being able to do this. So we kind of progressed actually because he made so much progress, but we started off pretty simple, but he progressed to kind of this, I think in this one he was making like a 3 or 4-step meal. So he was pretty pumped about it. So here, obviously you can tell that we worked on just his standing balance while standing at the stove. He was one that would his hips would immediately go on the stove, and he was lighting another part of the stove top. So we really worked on his balance so that he didn't have to do that. And obviously, as you can tell, he's using both hands, which was really tough for him. So there's a lot of therapy that goes into it, not only cognitive with the multi-step, but also just his balance, dynamic coordination, all of that. Just a couple ideas.
And then this last one is kind of just showing you guys that community-based approach. So along with doing that cooking, some of the roles that these guys want is, how do I provide for my family like I used to? Knowing that maybe they're not working right now, so what are some things that they could be doing, whether that's volunteering, whether that's going to the grocery store to get the supplies to go home and do some cooking. That's something that these guys are also doing. So this is a video of a guy in a grocery store, and I'm kind of walking him through, navigating him through the store, where he should go, cueing him to his grocery list. I will say, when we first did this, his caregiver was with him, and he needed maximum support to be able to remember what was on his list, attend to his environment. So he had a really bad left neglect, and so we were cueing him constantly of where to go in the store, what items he needed to get. By the end of probably, I would say, a month of doing this, he was able to be dropped off in the store, and I'm just kind of sitting in his cart. He positions me in the cart in the iPad, and I walk him through and provide him cues, and then he's able to even manage his money to check out at the end of his session, and call his wife and tell her, hey, I need to be picked up at the store. So something that he really just an increase in independence from that standpoint. And I think it gave him, just a fulfillment of his day. And not only that, but just purpose. He had 2 little guys at home that they were providing for. So gave him that sense of purpose as well. So just to kind of end, close things off a little bit before any questions, just going to show you guys a quick little video of our TeleRehab services, and yeah, we can answer any questions. All right. Does anyone have any questions?
Okay, well, I don't hear any questions at the moment. Neely and Melissa, thank you so much for joining us. That was very interesting to learn more about TeleRehab. I especially appreciated seeing the videos. I have had a hard time wrapping my head around how you can do this for physical and occupational therapy, but no, I think it's great. And I mean, the list of amazing benefits is extensive.
Yes.
Has there been any movement, with the roadblocks, especially with policies and regulations as far as payment is concerned? Any movement in a positive direction with that you're aware of?
I think so. I think that there is some movement, especially with private insurance. I would say that with is very small, but we're moving in that direction. So yeah, I think that that's something we're starting to explore as private insurance. We haven't yet served that, but I know that that's one of our goals, and we're moving in that direction. So
good to hear. Also, with the timing of the services, I assume most of your clients are individuals who've had fairly recent brain injuries, but do you also have many clients who are, months or even years beyond their injury?
yeah, I would say actually we have a handful of clients right now that are a couple years post-injury. So again, I think that there's a lot of value in just looking at, people get in routines, and our brains love routines so much that you kind of keep doing the same thing. And that's where I think that we've been the most helpful in years post, is coming in and saying, gosh, this person has progressed, his routine has it. So he's a lot more capable of doing this, and this, or have we thought about maybe doing something purposeful, or, so exploring other options. So I think that's been some good feedback that we've heard, is just coming in and kind of disrupting it in a good way, of just looking at somebody and kind of pushing those family members or caregivers to see if there's anything else that they could be doing more independently.
Yeah, I can certainly see that, the value. Yeah, not. Also, go ahead.
I was just going to say, this has been fun. Thanks for hosting us.
Yes, thank you very much. And we have your contact information here. I'm hoping that you'll be hearing from individuals here in North Dakota Also, do you work with like skilled nursing facilities and critical access hospitals who maybe are caring for brain injury patients that don't see that population very frequently? Is that something that is
You mean
common?
as far as like consulting wise, or?
Right, like therapists in those settings who perhaps are caring for a brain injury patient.
Yeah, we're definitely open to that. Just on, just discussing with them what we've, just knowing that that's our level of expertise and that's what we see every day. Yes, we're definitely open just to consulting and providing that education or whatever knowledge that would be helpful, especially in those settings. So.
All right, good. Any final questions before we wrap up this afternoon? Okay, well, thanks to you both again. And I have the North Dakota Brain Injury Network contact information listed here as well if you have any suggestions for future topics or want more information on the Brain Injury Network resources as well. So have a great rest of your Wednesday.
Thanks,
All
Janet.
right, thank you.
You bet.